As part of the spinal cord disorder discussion, here we talk about syringomyelia, that is, presence of cavity within the neural tissue. All right, it could be within the CSF space, which could be what, central canal or the subarachnoid space, or within the actual spinal cord tissue. All right, so syringomyelia can basically interfere with sensory or motor function because depends on where it is, which track it would be interfering with, the function of which track it would be interfering with. Okay, syringobulbia is where it affects the brainstem. Okay, so the cavitation from the spinal cord would move up to the brainstem. That can be extremely dangerous because brainstem area is where you have these vital centers, and those would be affected and can be quite a serious issue. Okay, and now mostly congenital, meaning these cavities are formed during the developmental stages. However, there could be other conditions. Malignancy is one. Okay, trauma could be another one that would allow cavitation to occur. Okay, hydromyelia is dilation of a central canal. So basically, there are many definitions here. One of them is the syringomyelia, that is cavitation within the spinal cord. Bulbia is where you have the brainstem involved, and then you're talking about hydromyelia. It's just the central canal that expands, and not the neural tissue as such. So what are the consequences is what we want to think about here. Why do we want to even talk about? Well, the consequences of this cavitation won't even appear till about third or fourth decade, although it may be formed early in the development. All right, it could be affecting the sensory pathway, spinothalamic pathway, affecting sensory signals from reaching the brain. And then, as you know, spinothalamic pathway deals with pain and temperature. Those sensations would be affected. And progression to lower motor neurons, muscle weakness, wasting. And then you have a couple of things to think about here: loss of reflexes, paralysis of palate, tongue, vocal cords, loss of sensation in the face. These things that you're thinking about could interfere with your handling of the patient. Thoracic scoliosis, this could have a consequence on a ventilation perfusion mismatch that could make it even more dramatic, right? So those are some consequences of cavitation that occurs in the early period of life. However, it manifests itself in the third or fourth decade, affecting sensory and motor functions of many structures. All right, and there is no known treatment, and some of the things you have to keep in mind is what kind of sensory deficits there are, or motor deficits there are, and how the drugs like the muscle relaxants or certain anesthetic agents affect these conditions. All right, so that's all we want to know about syringomyelia. Thank you.